I'm picking up on the shoulder reflexes. We just left off on a lecture about where the shoulder reflexes are. If you want to get the entire shoulder girdle, or maybe somebody's going to say they had a problem with a rotator cuff injury or something like that. So what I wanted to bring attention to is that we're not going to just work the one shoulder joint reflex that's in zone 5 under the pinky toe on the pad of the toe. Definitely we're working that as a reflex. It's going to be incredibly relevant, but that's not the only part of that whole shoulder structure that's going to be relevant. We also will have a couple questions we have to ask our client to really determine where it is on the shoulder that's going to be where we have to focus on, especially the areas we want to get client feedback while we're working. So is this something that's like a bursa problem within the joint? Is it an actual injury that they've had, like falling, an impact injury or falling on the shoulder? Is it an overuse injury, like a frozen shoulder? And then how much of this whole shoulder complex does it involve? So a frozen shoulder would be really everything, all the way across the front of the shoulder, back of the shoulder joint included, and the muscles between the shoulder blade and the spine. If it's one shoulder that had an injury, how long has it been there? Because they're probably favoring the other shoulder to do things like lifting and carrying and reaching if one is injured or has had long-term chronic injury where it's frozen in place. Okay, so we're going to have lots of questions with our client about what's happening so that we have an idea already where we're going to start working. And then we start working and we're palpating as we're working. We want feedback. We want to find out where exactly it's tender. Those are the areas when we find out exactly where within a reflex is tender. That's the body's way of telling us, like, work here, help me right here, this is the spot. Okay, so we will work the shoulder reflex, which is the shoulder joint reflex. I'm not really working it, so I'm not using pressure, I just want to show you where, developing a treatment plan. We also remember that the scapula comes across the ball of the foot, and it's intended in the real body to slide across the rib cage. Okay, so the joints between the actual scapula and the ribs themselves, they're meant to glide. And then the muscles between the spine and the shoulder blades are really in zone 1, also in the ball of the foot. But we do want to make sure that we're working along the top of the foot as well for that chest and breast area, because we do want to work the clavicle, which is going to be very close to the top of the chest and breast reflex, below the toes. We also want to work the pectoral muscles at the front of the shoulder. Okay, so we're going to work the whole top of the foot, the whole bottom of the foot, and the shoulder reflex. And while we're doing that, we're really getting in there and asking and communicating with our client where is it most tender, because our client might say, as I'm working in this area, that it's quite tender, or my client might say when I'm working in this area that it's very tender. And either way, where the tenderness is, that's where I'm going to go back and focus more of my work. Okay, that's the body's way of asking for us to focus more attention there. What I could add to shoulder work, I could work the affected shoulder, I could work the opposite shoulder in support of the affected shoulder, but also it might have its own imbalances. But what else could I work aside from the shoulder reflexes that's like the buddy system in reflexology? What likes to help the shoulder in the body? Buddy reflex of hip. So I can work the lateral hip reflexes, I can work the medial hip reflexes. If I'm working the shoulders, is it possible that with a shoulder injury I also have some neck tension? What if it was a car accident, my shoulder was injured, my neck is secondary to that, but also is going to have some effects. You can work up the neck as well. Even if there's no symptoms showing up in the neck, you can still work the neck to affect the shoulders. Just think of a regular tension pattern, tight shoulders climbing up the neck over the head. Okay, so we can work neck, we can work shoulders, we can work the referrals for the hips. We could also work pain reflexes. And one really good pain reflex is the pituitary reflex, which is dead center of the toe pad. That's a tiny reflex, so we'll hook it. We'll roll up onto the top of the tip of the thumb or the edge of the thumb and press in and down, and we'll do the same thing on the other side. So those are both pituitary reflexes at the same time for pain relief. We could also work a number of chronic pain reflexes, which we have in our textbooks and our courses, and our students learn. And we could also work the anti-inflammatory reflexes, which would be really important post-surgery or post-impact injury or car accident, because even if something like arthritis is part of what's going on with the symptoms, because the body's ability to decrease inflammation is going to really play into freeing up movement and allowing things to heal better. So what we'll do for our anti-inflammatory reflexes is we'll work the adrenal reflex, which sits on top of the kidney, so right here. We'll also work the kidney reflex to remove any excess fluid that was between the cells in the tissues, then ended up in the blood when lymph was collected, and now we can allow the body to pee it out, right? So we're working on the kidney as well to filter out excess fluid. And we can also work all of the lymphatic reflexes, which are between all the long bones in the top of the foot, as well as lymphatic drainage, and that would be for both feet. Okay, so all those reflexes would be both feet. One of the advanced things that we can do, that would be like a typical treatment plan. One of the advanced things we can do is we can actually loosen the joints within the foot and think about the reflex level that you're affecting here. Is you want to free up energy that might be congested within reflexes. So if we're doing this all the way across the foot and loosening all the joints within the ball of foot, imagine that you're loosening and allowing it to free up any congested or tight energy or energy blockages throughout that entire shoulder area, not only just the back where the scapula is, but the front of the chest as well. We can also do some toe tugging, and we can also just bend forward and back the toes, which is affecting the joints within the ball of the foot. Now, we're not working it to affect the joints themselves, we're affecting it just for general movement, that if there is some energy that's congested within here in the reflex areas, that we're helping the foot to be able to free up that congested energy via the reflexes. So we can add a few extra things in here. If I'm doing a chest opener, which sometimes we relate to as a lung opener, is this also a valid thing I can do when I'm trying to open up the channels for the lymph? Is it valid if I'm trying to open up space for the shoulders and allow for the shoulder blade to glide across the rib cage? Turns out it is. So I can also do energy openers, or chest openers in this case, plantar and dorsal. And I could even do that energetically by just holding the space and intending for the bones to spread apart. And if you're energetically connected, if you're doing biofeedback, if you're doing Reiki or any kind of therapy that involves energy, if you just sit here and you hold that and you intend for that spread to happen, then you or your client might also feel just a little, like just a little loosening, and your hands might feel like they're slightly floating out. You might not really see anything happening there, but that's one of the energy approaches that we also learn in advanced reflexology. So there's a nice little package of treatment plan for shoulder area, and I hope that helps you.